Oh, hi, Dr. Whitehead. Hi. I am Dr. Pittman. I am the ER doctor this afternoon. Listen, I got patient Cindy Wisdom. She's a 72-year-old female that came in with abdominal pain. Patient has a history of pulmonaria. She also says she has cervical cancer. Patient is under care right now still. She is allergic. Well, she mentioned that if she does take penicillin, that as a child she would break out into hives. We did find blood in the urine. She came in today in the ER complaining with blood in the urine. Patient has had history again regarding urinary inconsistency and neoplasia. Patient has been informed though to drink lots of water, and will be given discharge instructions for comfort. Again, she's a 72-year-old female. She came in the ER around 9:15, somewhere around there, tonight, complaining with diarrhea and abdominal pain. The patient said that earlier in the AM hour she had a bad headache and a change in her vision. Patient has cervical cancer and has a problem with hematuria. Patient said that she had noticed for the past 2 weeks that she had been seeing blood in her urine. When asked if she had any signs of nausea or vomiting, she said there weren't any. Right now, as we speak, though, the patient she does see, she is taking chemotherapy. She's doing that once a week. Right now, she is not on hospice, but she does live alone. Her vital signs are reading to be a temperature of 99.4. That was done oral. Her blood pressure reads 131/81. Her pulse is about 115. Her height is 172, and her weight is 172, and her height is about 5'7". When I looked at the patient, she appears to be very hypertension. Eyes appear normal though. Her nose passageway was clear and is clear. And on a scale of 1 to 10, when I asked the patient what was her pain, she said it was 10 and above. Patient has also said that her muscles feel tight and weak. And so we are having some emergency testing done. We're having a hematuria test done on the patient. Right now, she has been given a normal saline of 3 liters, and that's been going on for the last every 2 hours. For the pain, she is given morphine for comfort until the duration of her stay in the emergency room. Patient was later on instructed to have 500 milligrams, though, by the mouth. While the patient is here, we have advised her to see a urologist for continuing procedures. Patient has also signed a consent for a blood transfusion. Right now, as we speak, there's no signs of fever nor nausea, but patient is still discomfort and in abdominal pain. At 12:23 a.m., when I last checked her, her vital signs were reading normal. The patient was given a catheter and would have that through the duration of her stay. Her diagnosis thus far is hematuria, cervical cancer, and urinary obstruction. She has to follow up with her primary physician when she leaves here within the next 2 to 4 days. And also has been instructed to continue drinking lots of water, and also has given instructions for the hematuria. So I'm getting ready to leave my shift. So that is what is going on thus far with Miss Odom. Thank you.